Namaste, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Tuberculosis is a condition which involves any part in the body. It can involve, commonly people recognize it as an infection in the lung, but any tissue in the body can be infected by tuberculosis. It is just like any infection. Any infection is a stressful condition for the body, and any stress can give you a lot of hair fall. See, not only tuberculosis, nowadays we see a lot of people who have recovered from COVID face severe hair fall. And this hair fall is not like in 50, 100, it is like 400, 500, 600 to that range. So whenever there is an infection, that inflammation itself may give rise to hair fall. But why does it happen? Basically because, see, whenever there is an injury or a trauma to the body, whenever something is not going right in the body tries to conserve energy, it tries to protect itself. If a hair follicle is rapidly multiplying and increasing, then it is more prone for damage. If it goes for hibernation, then it is more protected. So that is what is happening here. Any medical illness, be it tuberculosis or dengue or chickungunya or COVID, the hair follicle stops reproducing. So it goes for a state of resting. And these hairs usually they shed after 2 to 3 months. And this is what is called as Telogen effluvium. And this is not something peculiar to tuberculosis, as I told, and it can happen with any medical condition or even a major surgery. Second aspect is tuberculosis is a condition which gives rise to a lot of nausea, weakness, loss of appetite. So that itself, so when the nutrition is affected, that can also give you a lot of hair fall. And third component is medications. Medications, there are a lot of tablets to be taken in case of tuberculosis because it's becoming more resistant nowadays, and it gives you a lot of gastritis. Sometimes there can be hepatitis. In those situations, again, the diet is modified. People can't take a lot of food because of the gastritis, and the catabolic state is there when you have any medical condition. So whenever there is tuberculosis with a lot of weakness, then it's a catabolic state. So then the requirement for nutrition is also more. At the same time, the catabolism itself will reduce your appetite. Because of all these reasons, the infection, the protection aspect of the hair follicle by going into a resting phase, the nutrition which is affected, the appetite which is affected, because of all these things, hair fall can be seen. But the good part is this type of telogen hair loss usually recovers completely unless people have a pre-existing hormone-induced hair fall. For example, a person had a little bit of baldness, and that can get aggravated because of tuberculosis. See, if he loses 100 hairs because of tuberculosis, probably he won't recover all 100. He will recover around 70 or 80, but 20 to 30% goes off. So that is what I meant. So if it is only because of the disease, 100% the hairs will regrow, nothing to panic. If you have a pre-existing androgenetic alopecia or the baldness tendency, then some amount of deficiency will always be there, but it can be treated.